Hi, my name is Eduardo. I'm here to demonstrate how to do a buccal midazolam administration. Um, so, first of all, this is my client. This is Rapunzel. But I will be reading off this administrative order I have here. And her name today will be Frederick John Brown. Just sorry about the camera. I just don't have a lot of space to work with. So today I'll be showing you how to do the midazolam administration for Viva Buccal. So first up, we gather all our equipment. So today we'll be using a solution to simulate the midazolam. I also have a pair of gloves that I have here. I also have a syringe just in case we're only partially using the midazolam or the liquid that's in there. I also have the emergency medication order, and I have some spare tissues that all came in the pack that I was presented with today. So first of all, as always, we always wash our hands. If you obviously can't wash your hands, sanitizer will do, and gloves if they're available. We can also put them on. Just keeping the hygiene is all up to date and correct. We don't want to be doing any giving any bugs or anything around by not handling it properly. So first off, I'll go on by pretending to sanitize my hand, wash them, sanitize. Then I will apply my gloves. Okay. Now, what we would like to do is to check the administration order. Just make sure that everything's alright. Date of birth, all that sort of thing. So first of all, we'll be checking that this is Frederick John Brown. We will also be checking the date of birth, which is the 1st of the 4th of 92. We'll also like to check that when is the midazolam should be given. So on his administration order, it is if the seizure lasts more than 5 minutes. We've also got here when his other dose of midazolam can be given. If it says if Fred has had another one in 4 hours. Also gives you the information of when to call the ambulance. Here, as soon as it starts, we should be calling the ambulance. And the dose should be given is 5 milligrams, megagrams, which is one mil. So it's also been obviously signed by the Dr. John. We've also got a contact number and the date that it's been signed, and we'd like to check making sure this making sure this authority is up to date. So it also gives you a rundown of the doctor's instructions and how to use to give them the midazolam. So it says here, read doctor's instructions. Obviously identify the package and the medication. So I've got here also his Zamius midazolam. It says 10 mil per 1 mil for extended seizures for more than 5 minutes. Administer 10 milligrams per buccal route only. Frederick John Brown. Expiration date the 12th month of the 26th. Now, that's all good. So now what we would do is we would now check it against the medication he has. So So checking that the expiry date is valid, and that everything matches up. Usually these would have a pouch with a little label that will tell you, this is Frederick John Brown's. It will possibly have his date of birth, and how much to give. We'll check all those things against the administration order, and we will determine that this medication is for him, and that this is our patient, Frederick John Brown. We'll at least check that every time we look at before we're going to give it. Especially just double check again. I know that we've read it, but it's always good to make sure definitely 100% that this is Frederick John Brown. To open this capsule, we would twist the top of the plastic ampoule to open it. All right. Now, if the ampoule is if there is more in here than the dose that we require, we would use a syringe. You can suck it up if you only need a little bit. Now we would administer the medication. So the medication would be administered into the side here of the mouth, followed by putting her in the recovery position, just so that way, obviously, I'll try my best. Sorry, just to make sure if any vomiting or any of that sort of thing, hopefully there won't be a choking hazard, and all the vomit would come out. We would also monitor her, especially her breathing, to make sure she's breathing okay. But on this particular authority, as soon as the seizure starts, we'd be ringing the ambulance, as per the authority. But yeah, a big step is to monitor the breathing, obviously to make sure that she is breathing correctly. Obviously, you don't want her to obviously stop breathing. Document everything that we have done, especially just so that when the ambulance come, that they've got, even if you document it a little bit, they will obviously have all the information. You won't forget anything, and everything will go nice and smoothly. Then eat at the end, tidy up, make sure that there's no mess left over, that any excess medication is disregarded appropriately when the ambulance take over. Thank you.